Trauma related to hurricanes. Rachael Sandora, Marissa Van Name, Bazhena Barker.
What will be covered in our presentation is the trauma topic being covered is natural disasters, specifically on hurricanes. A psychological occurrence that may or may not directly cause bodily harm is known as a trauma. A hurricane can be classified as a natural disaster and can cause a multitude of trauma. A hurricane is known for how violent the conditions are and is a storm of the most intense severity. Hurricanes can have high winds that are a range from 72 miles per hour or more.
The trauma topic being covered is trauma that occurs from the natural disaster of a hurricane. Rachael will be focusing on how hurricanes affect families and how multidimensional family therapy would be a beneficial therapeutic intervention to treat hurricane trauma. I will be focusing on how hurricanes affect children and how group therapy can assist in coping with the trauma. Bazhena will be focusing on how hurricanes affect people with disabilities and how cognitive behavioral therapy can help.
So for my literature review, I focused on families and hurricanes. So Hurricane Katrina occurred in the late August of 2005, causing around 1,800 deaths and over $80 billion in damages, affecting around 1.5 million people across the regions of Alabama, Mississippi, and Louisiana. Hurricanes not only impact individuals, but families as well. No matter how the family system was organized, all members were impacted, which could have caused grief since the hurricane caused much loss and change. After a hurricane has hit, everyone is affected. A traumatic event like a hurricane can impact a whole family because they go one day to having everything to the next having nothing or having to start over. If a family does have similar perspectives of a hurricane's impact, it was found that this will increase attachment to one another, while a family with different views of the hurricane's impact will cause conflict within the family's identity. Hurricanes can cause not only damage to the community, but also to the individuals within the community. Hurricanes can cause many individuals' limbic systems in the brain to go into survival central. Hurricanes can cause various social and psychological impacts, meaning that certain smells, sights, sounds, touches, tastes, movements, positions, behavioral sequences, and different reactions could cause an individual to have a flashback into time when they were experiencing the impacts from the hurricane. Social workers have contributed research finding on traumatic stress, disaster volunteers, voluntary populations, organizational networks, environmental disasters, cross-cultural and international issues and disasters, and improved measurement and theory in order to better assist with the recovery after a natural disaster like a hurricane, and how to better assist the populations that have been affected.
My literature review covered Hurricane Katrina as well. I know that Rachael spoke about it happening in 2005, leaving behind physical destruction, massive dislocation of the population, and over 1,800 individuals dead. 2,200 children ages 9 years old to 18 years old returned to New Orleans after the hurricane indicated mental health problems, depression, anger, difficulty concentrating in school, as well as in everyday environment, worrisome about the future, and having avoidance reactions. Prior to Hurricane Katrina, New Orleans was more than twice the national average rate. 38% of children living were in poverty. The murder rate in New Orleans were 10 times higher than the national average of 5.5%. Group intervention in this lit review was a 10-week session that consisted of 6 children per group who are close in developmental age. The 10-week session consisted of 3 phases: resilience, restorative retelling, and reconnected. The main goals of the intervention were for the children to learn more about grief and trauma, express his or her thoughts and feelings about what happened, and decrease post-traumatic stress disorder. Group interventions included activities to engage the children consisting of drawing, drama, play, storytelling, and creating a book of their own. In conclusion to the 10-week intervention, the children were given a book, and they were instructed to review the book for safety. the children that participated in the 10-week intervention having a feeling of accomplishment and excitement. This study's effectiveness will be evaluated after long-term follow-up of the participants. When disasters strike, whether they are natural disasters or man-made disasters, social workers and other mental health professionals must be prepared.
After Hurricane Katrina, 73% of all deaths in New Orleans alone were 60 years or older, but the age group only accounted for 15% of the total population. Although the exact number of the population of people with disabilities are not known, it can be expected that the ratio is similar. A high mortality rate amongst people with disabilities can likely be attributed to their functional limitation coupled with the environmental barriers, creating obstacles to safe exits, shelters, and access to medical attention during the aftermath of Katrina. Nationally, 47% of people with disabilities do not know who to call about their local emergency plans. Nationally, even though the danger from the natural disaster is higher in the people with disabilities population, only 20% of the country's level emergency managers have an emergency plan in place for people with disabilities. But a staggering 67% of emergency managers have no intention of making accessible accommodations to their emergency preparation plans for people with disabilities. I'm sorry, I just lost my place. My screen just went blank and I don't know where I'm at.
You're right here with in order for PWD.
Oh, sorry. Thank you. In order for people with disabilities to continue to live independently post-disaster, the community's existing social and civic services need to be extended to help accommodate the disabled population, including modifications in the way services are delivered to the overall communities. People with disabilities tend to have a very difficult outlook on their future possibilities after a natural disaster, likely due to the fact that most had to overcome significant obstacles already to live independently. Transgenerational trauma is where parents who have lived through previous natural disasters or other trauma have instilled in the younger generations the fears associated with their experiences. For example, survivors of Hurricane Katrina either lived through or had family members who've lived through Hurricane Betsy years earlier. Transgenerational trauma can easily exacerbate the effects of the current trauma experience. While transgenerational trauma can exacerbate a current traumatic event, it can also help significant coping skills and resiliency. The family member who previously survived a traumatic event can in turn prepare their children for an impending disaster. Therapists can take advantage of the built-in family and social supports that transgenerational trauma can create.
So the hurricane's psychological impact. Hurricanes can cause a panic leading up to the arrival of the storm, along with stress, recovery, and fatigue after the storm has passed. A natural disaster like a hurricane can lead to post-traumatic stress disorder. If a person has firsthand experience the hurricane, he or she could be feeling shock, anger, grief, anxiety, problems sleeping, depression, concerns about safety, and or fear once the hurricane is gone. A hurricane could affect a person's ability to socialize due to psychological circumstances, meaning that a person's PTSD symptoms or any symptoms at all are affecting the person's ability to live a normal life. Also, a person could be feeling alone when looking at the damages that have been done, but on the other hand, a person could be turning to the social supports to help them cope with the trauma.
The emotions that individuals experience years after a hurricane can linger in individuals' entire life. Emotions such as anger, grief, depression, hopelessness, uncertainty, feelings, feelings of anxiousness, feeling nervous and helpless, or just some feelings individuals experience through this trauma. Environmental trauma can lead to social isolation, which impacts an individual's well-being, job loss, financially unstable, homeless, loss of friends and family. Seeking help after a traumatic event in your life is imperative to cope with all the emotions and individual experiences. All individuals handle environmental trauma differently and experience different emotions.
Nate?
Mhm.
Hurricanes' physical impact. Long-term stress such as that experienced during and after a natural disaster like hurricane has many physical side effects. These side effects can include, but are not limited to, respiratory problems like asthma leading to panic attacks, cardiovascular issues such as heart attacks from the prolonged stress, diabetes due to the excessive release of stress hormones from the autonomic nervous systems and adrenal glands, and the inability to reabsorb the hormones back into the bloodstream. The gastrointestinal system can develop ulcers, acid reflux, diarrhea, and constipation, all from prolonged stress associated from the slow recovery from the natural disaster. Physical side effects can also occur to both the male and female reproductive systems.
So the therapeutic intervention that I will be focusing on is multidimensional family therapy. During Hurricane Katrina, families without resources to evacuate were stranded when the storm hit, and even after the storm hit, without any food, water, or shelter, while others that did evacuate were stranded in overcrowded shelters. Natural disasters like a hurricane overwhelmed the whole system. A traumatic event or loss could increase the risk of substance abuse. Some individuals may self-medicate with substances in order to cope with the grief and/or stress. Families face unique contextual and emotional challenges to recover within dramatically altered communities following the natural disaster. So why multi-dimensional family therapy? While most post-disaster interventions have been group or individually focused, converging several lines of evidence indicate that the family involvement can be critical to successful treating traumatized youth. Accordingly, practice parameters for treating traumatized youth prescribe parental involvement as a core feature of treatment, given that the parents can be an important support for the child and help monitor symptoms and reinforce coping skills, and are all the critical agents of changing once therapy is completed. Family therapy is able to assess and intervene in 4 different domains: in the adolescents or the children, in the parents, as a family as a whole, and the external systems. The therapist is able to address trauma and loss with the adolescents, parents, the family as one, in order to aim to improve coping and reduce the impact of stress on the family as a whole. By focusing on different aspects that the family go into family therapy, it has been found that family support is crucial in facilitating positive coping and long-term recovery. The therapist's goal is to rebuild the critical social supports that the family has in order to assist with long-term recovery. The family sessions allow the family as a whole to come together and share their feelings of trauma, loss, and stress, and also to address any conflict and/or other barriers that keep the family from moving past the tragedy of the hurricane. During natural disasters like hurricane, family units are sometimes reconstructed due to the loss. So how to implement multidimensional family therapy. First, you want to start off with individual therapy. This means having trauma-focused interventions in individual sessions with the adolescents. These sessions allow the adolescents to share his or her personal experiences and feelings about what happened by using trauma narrative work. Interventions focus on helping the adolescents develop and explore coping skills and effective ways to find support by communicating distress to parents and/or others. Therapists would educate adolescents on recognizing physical and emotional trauma symptoms and ways to regulate these symptoms. Second, you would be working with the parents. This means having trauma-focused interventions in individual sessions with the parents. In these sessions, it allows the parents to be reached as an adult with personal needs and issues, as well as a parent who may be having trouble influencing his or her adolescence. Interventions focus on parents functioning as an individual as well as a parent role. Therapists utilize interventions that address the serious stressors and life disruptions that the parents face post-hurricane, with the goal of assisting the parents cope effectively and resume an effective parenting role. Therapists also help parents look at their own parenting and become more available and responsive to their adolescence experiences. Third, you would work as the family as a whole. This means having trauma-focused interventions in the family sessions with adolescents and the parents. These sessions allow the family to practice and learn how to be able to communicate with each other, with each person in the family system, without excessive blaming, defensiveness, and/or criticisms. The intervention on enactment allows the therapist to shape and rework certain relational patterns within the family system that are stuck in negativity and pessimism. Therapists come into the conversation as needed in order to redirect the conversation towards positive aspects of the family system relationship, and focus on love and commitment to change what has been damaged in the family. And last, you would work as with the systems that are external to the family. This means having the therapist intervene on other systems that the family utilizes. Therapists assist families with linking them to services to help develop new, stable supports following the traumatic experience. These services could include, but not limited to, support groups, social services agencies, recommended treatment, and other community resources. In the YouTube video I chose, it's actually over an hour long. A lot of us probably have seen it in our previous class. The video is so long because it focuses on just bringing the adolescents in, and then the parents, and then as a whole. And then also, meanwhile, she works in looking at all the other systems that are involved with the family. Successful multidimensional family therapy is beneficial to all levels of social impact. On a micro level, adolescents, parents, and/or families could have difficulty with the impact to his or her brain, emotions, and ability to relate to one another. On a meso level, it helps improve the family's ability to participate in their community, perform better as a family system, and improve overall communication skills within the family system. Also with finding appropriate resources. At a macro level, this therapy can assist with understanding what is needed after a natural disaster like a hurricane, and how community resources are utilized and/or needed.
My intervention is group therapy. Group therapy uses the commonality of a traumatic event that has occurred in a group of individuals. Symptoms associated with traumatic events are bad dreams or memories of the event, feeling or behaving like the event is happening again, loss of awareness of present surroundings, avoiding thoughts, conversations, feelings, and people, detachment to environments, pessimism of the future, sleeping issues, irritability, difficult with mood swings, and feeling startled. During group therapy, members achieve a greater understanding and resolution of their trauma. Often individuals leave the group therapy session with feelings of more confidence, able to trust individuals better, and reach a common understanding of their impact. Sharing trauma-related shame, guilt, fear, rage, doubt, and self-condemnation, members learn to focus on their present rather than just focusing on the past. Speaking to members of the group help the members directly face the grief, guilt, and anxiety related to the trauma. To create a successful group therapy session, a lot might think it's easy, but it comes with a huge plan that you have to come up with. Clients that are experiencing anxiety, you need to create a zone or an area that's going to have comfort, and that has to be visual comfort, verbal comfort, everything around needs to be comfort. Even I read somewhere that even putting the oil essence in, letting that lavender relaxation happen so that everybody's coming into the environment in a calm, a positive way. You have to ensure that there's enough seats for the members of the group. You should have attendance of who's going to be coming into the group. You don't want to have too many seats and you don't want to have too little seats. You want to make sure there's just right amount so nobody feels that they didn't show up. Structure and framework is important to the client. So by creating detailed instructions at the beginning of each session will aid in the confusion. Explaining the time of the group, the location of the group, the duration of the group, and the size of the group of the participants that will be participating in the group. You also need to include in rules if there's no any drinking or eating in the group. This should be explained verbally as well as included in a written material. Providing written materials covering the sessions weekly due to the high level of anxiety of the client is experiencing, many clients won't absorb what you're actually saying verbally, so having something in writing so they can read over. Explaining verbally and in writing the rules pertaining to participation of the group session. Many sessions, people are nervous about participating in the group, but explaining to the members of the group how you would like to participate. If it's raising their hand or going around the circle to take turns, you have to explain this in a detailed way. Group therapy may begin after you ask if there are any questions pertaining to the rules provided orally in writing. Depending on the kind of group that you're going to be having, since there's so many different group therapies, you want to start the therapy with an open-ended question so that all the members of the group have a response. The YouTube video that I did provide is a step-by-step instruction on how to coordinate a group session and how the group session and the participants should be responding. On a micro level, group therapy is beneficial to an individual on a micro level because of the individual's experience. Many people feel that a traumatic event has only happened to them and they don't feel that it happened to anybody else. So when you're involving that client in an environment that everyone shares the same event or same traumatic experience, the individuals leave a session feeling more confident in themselves. On a meso level, group therapy happens in many different environments, such as schools. Group therapy can benefit the individual on this level because of the common values of the school or community, church, health programs, and clinics. A lot of schools currently have sessions in regards to bullying, which is common. Clinics, they have a lot of things in regards to people passing. So there's so many different ways of performing group therapy on a meso level. On a macro level, group therapy can aid in the advocacy to encourage state and federal governments to change policies. So for example, with Hurricane Katrina, having group therapy sessions and hearing the past experience that happened to the individuals that were victimized of the hurricane can help advocate for future natural disasters. Okay.
Although cognitive behavioral therapy has been most broadly related to being needed once a formal diagnosis has been determined, research shows that many people with formal diagnoses do not believe they may need help, and some not diagnosed believe they do need help. Cognitive behavioral therapy can address a wide variety of post-disaster stress diagnoses, such as depression, anxiety, and post-traumatic stress disorder. A focus on distress instead of formal diagnoses reduces the need for extensive assessments and increases feasibility of treatment in the community instead of the confines of a clinical setting. Cognitive behavioral therapy treatment includes psychoeducation, breathing techniques, behavioral activation, and cognitive restructuring. Cognitive behavioral therapy should be somewhat tailored to the individual, but one example of a 5-step cognitive restructuring program goes like this. Describe the situation. Identify the negative feelings associated with the situation. Identify the thoughts related to that feelings. Challenge the negative thoughts associated with the negative feelings. Making a decision on how to improve thoughts related to the situation that can improve overall feelings associated with the situation. How cognitive behavioral therapy works can be adjusted depending on the client, but the overall process is essentially the same. During the client's narrative, the therapist determines negative thought processes and feelings that are distorting the client's perception of the situation. Then, through the steps outlined earlier in this presentation, the therapist helps the client first realize the negative processes and their effects, and then helps the client to develop more positive thought processes and feelings that improve their perceptions. Here's a link to describe how cognitive behavioral therapy works on YouTube. Successful cognitive behavioral therapy is beneficial to the client in all three levels of social impact. On the micro level, a more positive perception can help improve personal relationships and increase the ability for the client to perform basic daily functions. On the meso level, cognitive behavioral therapy helps improve the client's ability to participate in their community, perform better at work, and improve overall communication skills. At the macro level, the application of cognitive behavioral therapy might help us as a professional working with other professionals to institute much needed change within our communities, especially in the treatment of post-disaster stress-related diagnoses. By using
multidimensional family therapy in my practice, I will be better equipped to provide trauma-focused interventions to family systems that were impacted by any natural disaster like a hurricane. I will be able to improve how well the family system communicates with each other and works together after experiencing a traumatic event like a hurricane. Multidimensional family therapy allows me to work with different dimensions that are identified in the family system in order to help everyone move forward from the hurricane. In my current practice, I try to look at all the different aspects that are involved with a person to better know what resources they have and what resources they need to be linked to. The different dimensions that are involved with multidimensional family therapy are key to a family moving forward as a unit.
By implementing group therapy in my practice, I'll be able to aid a group of individuals rather than one individual in the improvement of their traumatic event. By conducting well-organized groups that aim in the overall common traumatic event can help individuals cope with their emotional trauma to increase confidence in their future endeavors. Group therapy aids in several factors for a client. Feelings that they are not alone, gives client a support network, helps put the traumatic experience into perspective, and you can leave sessions by building the confidence, self-esteem, and self-worth of the individual. Group therapy is important to include in my future practice due to its positive influences to the client's future.
By being able to apply cognitive behavioral therapy in my practice, I will be better equipped to provide one of the basic tenets of social work, peer support. Helping a client through a difficult time by improving their outlet on a situation will increase their ability to follow through on directives, thus showing them that they themselves are capable of helping to obtain the much needed service. In my current practice, I can help provide context and lead for services, but it is up to the client to follow through and initiate the required processes. And cognitive behavioral therapy can help provide the client with an improved view of self-worth, giving them the initiative to help themselves.
And here are all of our references that we used. And that is the end of our presentation, and thank you for watching it.
Bye.
Bye.